Hello, I'm David Sweeting and I work as a senior physiotherapist with East Coast Community Healthcare. In this section, which is called Pain and Damage, we're going to look at understanding of pain and particularly the way our pain systems can change when we have persistent pain. Until recently, it was thought that pain was always a direct result of damage, and therefore you had more pain, you had more damage. If you had less pain, you had less damage. Now, in many cases, this is often reasonable, but if you think about it, there's a lot of examples when it's not. Take, for instance, two extreme examples. A simple paper cut. This is a minor injury that will soon heal, and it's not really going to distress anybody, but it can really be painful for quite a long time, can't it? Alternatively, at the other end of the scale, think about carbon monoxide poisoning, where you breathe in a poisonous gas that can actually kill you. There is no pain associated with that whatsoever. We've all probably heard tales of people in the war who were significantly wounded and felt no pain at the time. So it's clear from this that pain is not always a reliable indicator of damage. On the picture you see in front of you now, you will see an example that may be more relevant to some of you watching this video. You will see two X-rays, and these both show the low back, the lumbar spine. On the left side, you will see a normal, healthy spine. So there's no arthritis in the joints, the discs are perfectly healthy, it all looks good. The right side picture shows a spine with quite a lot of arthritis in it. There's osteoarthritis in the joints, and there's wear and tear in the discs, which we call spondylosis. Now, these are pictures of the X-rays of two patients of mine. And the interesting thing is that the patient who had the X-ray taken on the left, the normal X-ray, had very severe pain. They'd had it for years, they'd had many, many tests done, and nobody could find any cause of it. The patient on the right just had a bit of stiffness, really. So where there was a lot of damage, there was almost no pain, and where there was no damage that we could see, there was pain. So why is this? It now seems that changes in our pain system are very important factors in the amount of pain that we get. Just so you understand, when we talk about our pain system, what we're talking about are the nerves in our body that send the signals to our brain and the parts of our brain that actually interpret these pain signals. And it's now understood that the sensitivity of this pain system can change. It can get more sensitive and it can get less sensitive. So if the sensitivity of your pain system increases, then the amount of pain you feel will physically get worse, even though your injury or problem hasn't actually changed. And it's now known that when the pain has been going on for a long time, that tends to increase the sensitivity of your pain system. On the slide in front of you now, we've tried to show this. So you'll see that a patient who has persistent pain, then they actually start to get increased sensitivity of their pain system, which will increase their pain level, resulting in more persistent pain. So essentially, a vicious circle starts to exist. And as Ben said earlier, it's important to understand this is not imaginary or just psychological pain. Scientists have clearly shown real physical changes in the pain system that cause this. It's useful to think about your sensitive pain state as a bit like the amplifier in your hi-fi. If you turn the amplifier up, the noise coming out of your radio gets louder. In the same way, if the sensitivity of your pain system is turned up, the pain you feel will increase even though the underlying problem hasn't got worse. Again, we can illustrate this with the slide you see in front of you now. At the top, you can see a normal pain state, one that's not become sensitive. And as you can see, this individual has a problem, let's say a little bit of arthritis in their back, that creates a 3 out of 10 kind of problem in their back. As it goes into the spinal cord and up to the brain, because that's all working normally, then the brain interprets that as a 3 out of 10 pain, a pain that's in proportion to the underlying problem. Below that, you can see is the picture of a sensitive pain state. So let's imagine this patient has the same problem, a 3 out of 10 problem, a bit of arthritis in their low back. But because their pain system, the spinal cord and brain, has become sensitive, it amplifies the thing, so that the pain that's actually perceived comes across as 8 out of 10. And that's a real physical pain, a severe pain that they will feel. It is now known that many things that can turn the amplifier up and not the obvious physical things like injury. Science now tells us that chemicals in our bodies are probably one of the main things that make the pain system more sensitive without any new damage occurring. And therefore, anything that increases the amount of these chemicals will make the pain worse. And this is why it is thought that pain can be increased by factors such as stress and depression and fear, maybe previous experiences or expectations that something will be painful. And as we'll talk about later, fatigue and inadequate fitness also seems to be important. So what this means is that if you're getting low in mood or stressed about something, or you're getting stiffer and less fit, your pain will probably increase even though your underlying injury or problem has not been worsened. The good news is that the sensitivity of the pain system can also go down. And this probably explains why people with persistent pain often find they go through periods where the pain isn't actually quite so bad, even though, again, nothing about their underlying physical condition has particularly changed. So examples of things that tend to turn the amplifier down, we know, are being relaxed, being a bit fitter and more flexible, having more understanding of your problem, hence the point of this video, and using pain relief where it does help. What this means is, though there may be little that can be done currently about the actually underlying physical problem behind your pain, say for instance arthritis in your spine, there are things that you can do yourself to help improve the situation. For these things to help though, you must understand that increased pain and worsening damage are not strongly linked in persistent pain, and you need to focus on the way you manage your pain rather than looking for a direct cure. In summary, the main points we want to get over for this section are that pain is not a reliable indicator of damage in persistent pain. Worse pain rarely means you have more damage. The pain system often gets oversensitive, making the persistent pain worse than it was. And fatigue, lack of fitness, stress and anxiety will make persistent pain worse. But these are things that you can do something about.